Every year, nearly 500,000 strokes occur in Russia. A third of these people die immediately. But if you ask stroke survivors what happened to them before it occurred, a very important detail repeats itself time and time again. And that is what we will talk about today, as well as the important signs of a stroke that should never be ignored. I am a neurologist with over 30 years of experience, Professor Eduard Yakupov. In general, the word insult, stroke, translates into Russian as a blow or a strike. And a stroke is a condition where the brain lacks oxygen and blood supply in a significant area, a clinically significant area of the brain. When weakness appears in an arm or a leg, a person cannot walk or speak and they die. There are ischemic and hemorrhagic strokes. A hemorrhagic stroke develops almost suddenly. Blood spills into the brain or under the brain's membranes because a vessel has ruptured. This is a hemorrhage. Now, an ischemic stroke, 70% of all strokes are ischemic strokes, is very insidious because it resembles, it presents with a wave-like phenomenon. Symptoms roll in, symptoms recede, symptoms roll in, symptoms recede. And it is very important to understand here that in some patients, the phenomenology, the symptoms develop long before the main stroke because so-called, some of you call them microstrokes, appear, but these are actually transient ischemic attacks where a person might briefly develop weakness in an arm, lose vision, experience severe dizziness, or have impaired speech, and then it passes. A few hours later, and everything is fine. And he continues to live his life. 6 months, maybe a year, everything is normal. Then it hits him again. He ignores these symptoms and finally it hits him so hard that a severe stroke develops because he ignored his body signals. I can say that for 1 in 10 patients who experience so-called transient ischemic attacks, it all ends in a severe stroke precisely because of this very ignorance. And very often, when I look at an MRI of a patient who has had a minor stroke on their feet, there are changes, but they didn't notice them. They didn't notice them because they didn't know about them. And so the goal of our conversation today is to ensure you don't miss this phenomenon of a minor stroke. And here it is very important to understand what exactly is happening in the brain. After all, it doesn't necessarily happen, as many believe, just like that, a blockage of a vessel, a large vessel, and that's it. And a stroke develops. In reality, a short-term spasm can occur. There are several subtypes of ischemic stroke. I won't go into scientific details because when we talk about the blockage of a large vessel, for example, the carotid artery, well, a person might have had stenosis that was growing and growing for decades, but I will talk about that in future videos. And suddenly the vessel becomes blocked. That is when a major stroke develops, the so-called kind, with weakness in the arm. The person cannot walk, and when the vessels have narrowed, for example, atmospheric pressure has changed, a hemodynamic failure has occurred in the brain, there is a depletion of blood supply and in fact hypoxia of certain areas of the brain. This is precisely what manifests clinically in the form of short-term symptoms. HOP. Speech becomes impaired, there is weakness in the arm, dizziness, some instability when walking, and a kind of fog in the head, and then it disappears. We take a scan later, after 6 months or a year, and we see changes there. The person has suffered a minor stroke on their feet. There is this hypothesis of the penumbra, the half shadow. The thing is, when a stroke develops, a very small area appears, initially very small, where cells, neurons die off very quickly. But if nothing is done, then the hypoxia I mentioned, these depleted areas of the brain that are not receiving enough blood, these areas begin to rapidly increase in size. That is why time is so important. And there is a common phrase among neurologists: time is not money, time is brain life. If you waste time waiting for everything to pass, for everything to get better, and don't call an ambulance, that's it. Time is irretrievably lost. And what happens next? This volume of the core cerebral ischemia, where cells have died irreversibly, increases with every hour. This is very important. And you lose the golden hours, when it will be extremely difficult to provide you with qualified help. And the price is either life or severe disability. So what symptoms are very important and what should you not miss? There is a so-called test or algorithm called FACE. In Russian, it has been adapted into a different acronym, UDAR. Smile, movement, articulation, speech. Now there is a more subtle modification called BFAST. This stands for balance and eyes. The point is that when a person develops a stroke, their balance is impaired. If this happens, it is a danger signal, or as it is commonly said now, a red flag. Eyes, suddenly vision loss occurs in one eye. By the way, some of you might think this is an ophthalmological problem. Yes and no, because in a number of cases, such sudden vision loss in one eye is a sign of a stroke, a neurological condition. And then we proceed with this fast test. Face. Suddenly, a rapid, sharply developing facial asymmetry appears. The mouth pulls to one side. Next, extend your arms, and if one arm drops or weakness appears in it, this is also a red flag, a sign of a developing stroke. Speech impairment. I am speaking very clearly right now, and now I will demonstrate what happens during a stroke in a number of patients. Please remember this speech pattern, although there may be several. You can feel that my speech has changed instantly. A phenomenon of word salad has appeared. It's impossible to understand what I'm saying, and the patient themselves doesn't understand what is happening in this situation. And in this case, you cannot waste time, because this is a very important parameter. Let me remind you that there is so-called phenomenology of the penumbra, the ischemic half-shadow. When a stroke develops at the beginning, in the first minutes, a core zone of ischemia appears. It is very small, but over the course of several hours, the zone of brain hypoxia, of depleted blood supply, expands rapidly. If you don't take any real action, if you just wait around for things to get better on their own, this zone becomes larger and larger. And this core zone of ischemia, where the neurons have died, becomes huge. And in this case, the person may either die or end up with a severe disability. Please do not ignore this situation. Call an ambulance immediately. And there is no need to call a doctor from the local clinic. You need to call emergency services and go straight to the neurology department, where they will help you and provide specialized neurological care. Because in the case of a stroke, the first golden hours are very important. In the case of an ischemic stroke, we can provide high-quality help and restore blood flow to the brain. But this happens in the first hours after the stroke, when you haven't ignored your body's signals. So, you've called an ambulance, and your first instinct is naturally to provide some kind of help to your close relative right now, to give them some pills, lower their blood pressure. Some people even start trying to thin their blood. You must not do any of that. Under no circumstances should you lower the blood pressure. A paradox? Yes, it might seem like a paradox to some, but managing blood pressure should be done by doctors in the hospital. There is a nuance. If you give an antihypertensive drug at home and thus cause the blood pressure to plummet, you will create a very bad effect of additional brain hypoxia. This is very dangerous. The brain is already struggling. And by the way, there is a phenomenon where during a stroke, an ischemic stroke, the body pulls the blood pressure up a little bit. That can happen. A person might not even have hypertension, yet their blood pressure is slightly elevated. That is, the body itself creates a kind of backup for blood flow to provide this fuel, blood flow, and oxygen to the oxygen-deprived area of the brain. And if you drop that blood pressure, you arrive at a very bad result. What can be done? If a person starts having some kind of attack or seizure, essentially lay them down or sit them in such a way that if consciousness is lost, the tongue doesn't fall back, turn their head to the side, and that's about it. Your main task is to call the doctors as quickly as possible. And now another important point. This is for those who have watched our video to the end. After all, a headache or dizziness is not always a stroke. And weakness in the arm is not always a stroke. This is the nuance, because a person might have a migraine where half of their head hurts. But if, pay attention, you feel a terrible headache, the strongest one you have ever experienced in your life, and it is incomparable to what you felt during migraine attacks, sound the alarm, call a doctor. You might periodically have benign positional vertigo, which also causes severe dizziness with nausea, but it passes within 1 or 2 minutes if you find a comfortable position. With a stroke, this does not happen. The dizziness is very severe and is accompanied, as I already said, by speech impairment, weakness in the arm or leg, and sensory disturbances. And this dizziness can occur while sitting, lying down, or standing. But with benign positional vertigo, this does not happen. A person moves their head. Oh, dizziness appeared, but not when turning in this direction. And they lie down very carefully. It lasts for minutes, seconds. That is the difference. You woke up and you have numbness in your arm. It could be because the person slept on their arm, but if it is accompanied by the symptoms we just talked about, speech impairment, headache, dizziness, then it is not just from sleeping on the arm. In this case, you need to call a doctor, call an ambulance. You see how many nuances there are. Therefore, I recommend that you consult a specialist in time. And please, take care of your health. And remember, brain time is the time of your life. All the best.